Hello, Mr. Nguira. Good afternoon. Good afternoon. Good afternoon. How are you?
Well, Frank, I'm just perfect. How are you over there?
I am very well. Long time since we came and visited your
Yeah,
project in
long time. But, it's about time. So today, let's chat.
All right, Mr.
Sure.
Nguira. Please, I invite you to tell us about yourself so that people can know you better, where you grew up, and how you became a social worker.
I'm the founder and executive director of Action for Sustainable Development, which is actually a Malawian NGO. So I
Mhm.
founded it and I'm leading the organization.
Oh,
In terms of education, I'm holding bachelor degree in forestry. But now, what happened was when I stayed around, I found that in the community where I stay in Korongo, there are a lot of gaps which needed attention, in particular
mhm.
children.
Mm.
The prevalence of HIV/AIDS has been very great, and many children have been suffering, no great attention, poor health, illnesses, and the other children would die.
Mm.
I felt very much concerned about it.
Yep.
Now I had to drop my field of profession as a
Mm.
forester.
Mm.
I said, no, let me take myself into social work so that at least I have to contribute something. So that's how I came up with this organization with my colleagues um, to make sure that we do something about these children. They have to live long, they have to be productive, and they do something in a country that could be more good for themselves and for everyone.
Tell me then. You are withdrawing from becoming a forester and you are coming this community. What is this community you are talking about? Tell us about this community.
This community is called Nkorongo.
Mm.
I may share with you that the area is having 12,000 people. It's quite compacted.
Yeah.
Everybody's busy doing whatever I can do to make a living.
You are talking about children. What's the HIV/AIDS situation like there? What's the prevalence like in this community?
As I indicated to you, Frank, to say that HIV has been very rampant. And currently, in general, the HIV status in those cities is about 10.6%. But in
Mhm.
particular in Nkorongo, because of the services that we've been actually we are providing,
Mhm.
it is down. It is below. It is below
Wow.
5%.
I remember very well you mentioned two projects there. You mentioned two projects, and one an ART HIV clinic, and then the playground. And I remember very well the first being the playground. Okay, and from one that is
Yes.
not coming from wrong would wonder why the playground, and how did it come to pass?
Frank, I want to say this to you to say that when we talk of HIV, sometimes we look at certain things and overlook certain things as well. For example,
Mhm.
most of the people they would say to reduce or to combat the effects of hunger or impact of impact of HIV, you have to take good food, you have to take drugs, these obvious things. But
Mhm.
we overlook certain things which are also great use to the children and everyone. Now, it
Mhm.
was very surprising to say that when we called for a meeting for the
Mhm.
children in the community, they came large numbers, and then we asked them to say, "You guys, tell us um, what issues challenges you in terms of HIV."
Mhm.
And it was very surprising. We said we divided these children into three groups to say
Mhm.
we gave them the papers to outline the challenges that are facing in HIV. So they brought the papers together and
Mhm.
then vote based on what was received. And it was very surprising to say that playground was the topmost priority because children said we lack recreation. And you can see
Mhm.
that sometimes we overlook issues of recreation, but the children said we need recreation and we need a
Mhm.
playground. We're very surprised. So then we said, okay, this is great. let's look into. So the process was actually participatory, and we are very happy that it came as a number one priority to build a playground. So,
but the fact that you had to speak to the children, and the children really, and this is why they came up with a playground, because these are children we're talking about. These are children we're talking about. So they had to come up with whatever is good for them. And I'm very happy and excited that this happened in this way, because this is how us also as World Connect and Moses Connect, we operate. We believe in listening to the communities, listening from their voices, and letting them go forward and advise us on what is the pertinent issue that is happening. Now, as you rightly said, this playground has been identified by the communities. And you approached World Connect, which gave you $750, a small amount of money. But then the community also invested $350. I was wondering, where did this money come from in the community? Because you said these are poor people. Where did this money come from, and how did they contribute?
Frank, I should say to you that Nkorongo Health Center, sometimes Nkorongo community is well organized. This Nkorongo community, they have what they call Community Development Fund. They do contribute regularly. So they have a total fund. They have an account in the bank where they keep this money. Whenever there's a committee running this this fund. So when this project was chosen, and we assured for funding to say this is what Connect is coming into fund, and you have to do something. It didn't take long, because the committee just came into the pocket, the fund, tapped from there, and they straight away contribute.
You have constructed this playground in the community. From somebody like me who is an outsider, meaning I don't live in Nkorongo, what are the results that we can see? What can we see as a change that this playground has brought to the children?
You know, this playground has brought a lot of oneness. Now, this oneness has actually resulted into great access in terms of counseling from the health personnel at the center. The ARV drugs now are being received. So the sicknesses are no longer there. Counseling accessed. Adherence to ARV uptake. And even the parents themselves, they come to us to our organization say, the playground has been very useful. Our children are happy, they're growing healthy, they're interacting. So this kind of recreation, we know children will live longer now. Yeah.
Wow. And that's the best point of it, because you can do something, but if you're not getting the impact, then there's no use of building the playground. But if the impact is now to see the children are living healthy, they're able to go to school, or they're able to access the drugs, their adherence has increased, that's a big plus.
We are very much proud about this project.
Okay.
Because everybody now see the reality of life. Contribution that was made is seen to be meaningful.
Yeah.
World Connect, which we say Moses Connect today, the resource which was spent on this project is meaningful. Our energy as an organization which was spent in this project has been meaningful. The effort which the community had to put on this project is meaningful, because this playground and the clinic, they're not just laying there idle, they're being used. People are benefiting. The lives of the people are being saved.
Thank you so much for that answer. Very, very, very informative and very encouraging to see that the investment that we've made in that community, now almost 4 years down the line, people are still using their services. This is what we call sustainability, and I love to hear that.
World Connect or Moods Connect it encourages so much ownership of the project right from the start. They would like to see the project coming from the grassroots, not top down, which is quite sustainable. So this kind of encouragement, we see that this approach that keeps the project long time, several years standing.
I really appreciate for your time. We've learned a lot, and then be assured, we appreciate the work that you do for the people of Nkorongo, because one life saved is so many lives important to us as World Connect, and indeed, I believe to you, as I said. And let me commend you. You never fought when you defaulted leaving forest to come into saving lives. It's the best thing that we can do.